Hello, this is Michael, RT Clinical Educator Coordinator for HME Specialists. Today we are going to be discussing how to use a nebulizer. The nebulizer brand that I have today is Drive. We are going to be discussing how to properly set up and maintain your nebulizer. The nebulizer is going to be prescribed by your ordering physician for any patients that have pulmonary diseases. So let's go ahead and get started. All right, so we're going to be discussing some of the parts for the nebulizer. One of the first parts that is going to be included in your nebulizing kit is the 7-foot tubing. There is a T adapter. There is a 6-inch corrugated tubing. A reservoir, the cap for the reservoir, mouthpiece, filters for the machine, and of course the nebulizer compressor itself. Alright, you always want to make sure you follow the instructional manual in order to properly set up your nebulizer. I will be going over how to put your nebulizer together. So one of the first parts, let's go back to the tubing here. This is going to be connected to the nebulizer compressor itself. There is a outlet, flow outlet here that you'll put one of the end of the tubings just like so. Just make sure it's nice and snug. Then you want to grab your reservoir. This is where you're going to instill your medication. Usually pulmonary medications come in little vials that you have to rip the cap off and then squeeze the vial into your nebulizer reservoir. Once you do so, then you can go ahead and place the cap on the reservoir itself. Just screw it in nice and snug, and then on the bottom of the reservoir, you want to make sure that you place the other end of the tubing into the connecting port, just like so. Next portion of the parts that I have here is the T adapter. The T adapter is going to go on top of the reservoir. And that's how that goes. Now, with this particular nebulizer, I just have the mouthpiece. We can also order a mask if that is the preferred method of medication delivery. We can put a mask on there and attach it to the reservoir. Today I'm just going to be showing you how to connect the mouthpiece. The mouthpiece is just going to go on nice and snug on one end of the T adapter, just like that. And then you have your corrugated tubing, which goes on the other end. And this is your proper setup of the nebulizer. Now, with using your nebulizer, there is an on and off switch. The on-off switch on this particular nebulizer is right here. O is for off, I is for on. Press the on button, then you can go ahead and start doing your medication delivery. When you're using your nebulizer, you want to place your mouth fully shut around the mouthpiece if you're using a mouthpiece. If you're using a mask, you're going to want to place the straps behind your head, and the mask will sit on your face there. And the nebulizer will be right below the mask itself. So you're going to, for this demonstration, I have the mouthpiece. Just place your mouse fully around the mouthpiece. You want to make sure you take slow, deep breaths. Your physician may even have you pause momentarily during inhale so that that medication can be delivered into your lungs as it should. Usually the nebulizer medication regimen is about 10 to 15 minutes long. depending on what medication you are using. As soon as your medication runs out, you will begin to hear a sputtering sound. That is normal. There might be still some medication that may need to be delivered, and what you can do is you can tap this a couple of times, and then I'll get the last remaining medication that's in the reservoir. But the medication regimen usually takes about 10 to 15 minutes. Once you are done with your medication delivery, you can go ahead and turn off your nebulizer. You want to make sure not to allow your nebulizer to run more than 30 minutes. You want to run this intermittently. If you let it run continuously, this could potentially burn out the motor of the nebulizer. So keep in mind not to exceed more than 30 minutes with your actual nebulizer so it doesn't overheat and burn out your motor. Now we're also going to be discussing how to clean the nebulizer. Cleaning is very easy. All you need to do is take all your remaining parts apart, and then you are going to place it in warm water and soap, just normal detergents such as Dawn soap, baby shampoo, even palm olive soap works. You are going to grab all your parts and you are going to wash and rinse thoroughly. You want to make sure that your nebulizer parts air dry. Please do not place this in the dishwasher. We do not want any of the parts to melt or distort in size. So just keep in mind to keep it out of the dishwasher, just hand wash only. Also, before every use, we want to make sure that we disinfect the nebulizer. What you can do to disinfect it, you can just get 3 parts water, 1 part vinegar. Let the parts, excluding the tube, do not place your tubing, but all the other parts of your nebulizer, you can place it in that 3 parts water, 1 part vinegar, and then let it sit there for 15 minutes. Then take the parts out and then rinse it under fresh water and make sure that it air dries, and then you can go ahead and use your nebulizer again. Please do not place your tubing. We don't want any moisture sitting in your tubing, as this could potentially spill into the nebulizer itself. So please avoid placing this underwater. You can go ahead and wipe this down with a damp wet cloth on the outside of the tubing, but once again, do not wash this. Alright, one more thing I want to mention on the nebulizer. On this particular one, by Drive, there is an internal filter to help keep the motor from inhaling debris. So what you need to do is take this cap off. There's a little filter that needs to be changed every 6 months. And then once you replace it, you can just go ahead and throw away the old one. If you have any questions, you can contact us at our main number, 505-888-6500. We do provide resupply for these nebulizer kits. Usually these kits can be used several times, but you can get a new kit as needed on a monthly basis. And once again, you can just contact us at our main number. Thank you.